Your doctor says you need an MRI, some medication, a surgery, a specialist visit, maybe some treatment. And then you hear the words that nobody wants to hear. Your insurance requires prior authorization. And suddenly you're stuck waiting, making calls, wondering whether the care your doctor recommends is actually even going to happen. Well, here's exactly what a prior authorization is, why it gets delayed, and what you can do when the process stalls. Prior authorization is simply your insurance company requiring approval before it agrees to pay for certain care. This could be medication. It could be imaging like an MRI or a CT scan. It could be a procedure, surgery, infusion therapy. It could be medical equipment or a referral to a specialist. The frustrating part is this. Your doctor already believes you need the care, but your insurance company may still want more documentation before it agrees to cover it. It doesn't automatically mean the care is not medically necessary. It often means someone needs to just send in the right clinical notes, the test results, the diagnosis code, or treatment history, or they just need to submit the right paperwork to your insurance company. And that's where things get stuck. Sometimes the doctor's office hasn't even submitted the request yet. Sometimes the insurance company says it needs more information. Sometimes the information was submitted, but it was under the wrong code, under the wrong provider, or the wrong location. Sometimes the insurance company denies it because you need to try another treatment first. And sometimes nobody calls you until the appointment's already delayed. So what should you do? First, find out whether or not the prior authorization request was actually submitted. Call your provider's office and ask. Say, hey, has the prior authorization been submitted to my insurance company yet? And then ask, what's the authorization number and what service or medication was submitted? That gives you something concrete to track. Second, call your insurance company. Ask whether the request is pending, approved, denied, or waiting more information. If it's pending, ask exactly what's missing and who they're waiting to hear from. Do not settle for it's under review. Ask specifically what information is still needed and when was it requested. Third, write everything down. Keep the date, the name of the person you spoke to, the reference number, and take notes so you remember what they told you. Healthcare is complicated enough. You don't want to have to start from scratch every time you make that phone call. Fourth, pay attention to deadlines. If the request is denied, you may have appeal rights, but appeals have timelines, and those timelines can move pretty quickly. Ask the insurance company, what is the deadline to appeal this decision? Ask the provider's office, will your office submit the appeal, or do I need to do that myself? You do not need to become an insurance expert overnight, but you do need to know who owns the next step. And this is important. Do not assume a denial is final. A denial may be overturned with better documentation, a corrected submission, a peer-to-peer review between doctors, or an appeal. Sometimes the first answer is no because the process is incomplete, not because the care is impossible. That said, do not wait quietly if your health is being affected. That said, do not wait quietly if your health is being affected. If you are facing delay, ask your doctor whether the request can be marked urgent or expedited. This doesn't guarantee approval, but it may move the review faster when waiting could seriously impact your health. Prior authorization is one of those healthcare processes that makes people feel powerless. But you have more leverage when you know the status. If you know the missing piece, document your calls and push for the next clear step. If you're dealing with an insurance denial delay, a prior authorization issue, download our free insurance denial help checklist. It's at cornerstonehealthadvocates.org, insurance denial help. There's going to be a link to this in the description. But that's going to help you organize all the information that you need before you even make that next call. And do me a favor, subscribe here for just practical healthcare help for working families because the system's complicated enough to do it by yourself. So thank you very much and have a great day.